Well, hello there, and welcome to Medicare Made Plain, brought to you by AssureSource. You know, the last couple of weeks we've been doing a series of talks about foundational knowledge of Medicare. We started with Medicare Part A, then we talked about Medicare Part B, and then the most logical place for us to go with this week is going to be Medicare Part C, or Medicare Advantage. You know, Medicare Advantage seems to be one of those subjects that everyone has a very strong opinion about. They're either very strongly for them or they're very strongly against them. And here at AssureSource, we would like to think that how we feel depends on the client. There are clients that really need a Medicare Advantage plan. It's going to depend on a lot of factors. We'll talk about some of those today. Things from health to financial situations, all the way down to the region that they live in. But we also feel like that there are some folks who definitely don't need Medicare Advantage plans. And we'll talk a little bit about those as well. Well, again, we thank you for coming by. We hope you learned something today, and let's start talking about Medicare Advantage. So let's begin talking about what the experience is like for someone who is on an Advantage plan or Medicare Part C. If you remember, we talked about Medicare Part A and Part B. We went over everything that original regular Medicare covers. So the first thing we should say about an Advantage plan is that Advantage plans have to cover everything that original Medicare Part A and Part B covers, except for one thing, and that is hospice care. So if someone is on an Advantage plan and they go into hospice care, God forbid, then they go back and everything is covered under original Medicare Part A. And that's everything from doctor visits, hospitalizations, medicines, ambulatory charges, anything that is covered under hospice is covered under Medicare Part A. The second thing we should say is that most of these plans will include prescription drug coverage. However, there are some folks that may not need prescription drug coverage. This is most commonly going to be veterans. Maybe they can get their drugs at the VA, they can get TRICARE for Life or CHAMP VA, and so there are some folks that don't need prescription drug coverage, and so there are plans that are designed just for them. It's not always veterans. There are other individuals that may have maybe retirement coverage or something else. But for the most part, we'll see the folks that don't need it will be veterans. However, the majority of people will need prescription drug coverage, and most of these plans already include prescription drug coverage. The next thing we'll say about that prescription drug coverage is that in general, the prescription drug coverage is usually a little stronger in a Medicare Advantage plan as far as formulary and cost than it's going to be in a standalone Part D plan. The next thing is that these are mostly designed around copays. I like to say the easiest way to think about an Advantage plan in most areas and on most plans is that they're very similar to how employee insurance used to be. Okay, you go to the doctor, your primary care doctor, you'll have a copay. Normally this is going to be anywhere from free on up to $25 and up, depending on the plan, depending on the region. There's lots of different variables that go into that. If you go to a specialist, you'll also have a copay there. They could be anywhere between $25 and $55, $65, and sometimes you'll see that they will have a percentage or a co-insurance, but for the most part, there's going to be a copay. You usually will have copays for tests, you'll have copays for outpatient therapy, outpatient surgery, MRIs, CAT scans, PET scans, but you will normally have a set copay for whatever service that you're getting. The next thing we'll say is that they may or they may not have a monthly premium. In fact, in most markets, the majority of plans don't. You say, Dustin, how in the world are they free? They're not free. You've been paying for them your whole life. There's just no extra charge for them right now in most situations. And then lastly, they may offer extra benefits. When we talk about extra benefits, they will come with things like vision and dental, hearing, over-the-counter, And when we talk about over-the-counter, usually there's going to be maybe a website to go to, or a catalog to go to. Sometimes you can go to a local pharmacy and get some things that you would normally get over-the-counter at the pharmacy. Things like vitamins, maybe you need some first aid supplies, things like that. But not only will it cover these things, but you also will see these plans cover other things such as gym memberships and more. Now, this is where we at AssureSource depart from other folks that talk about Medicare Advantage. The majority of agents, the majority of commercials you see on TV, they're going to talk to you about these extra benefits. All of these free things that come along with the plan, and they are great, but I will tell you that is not the reason you choose your health plan. I feel very strongly about that just from my life experience. The reason I say that is this. Is that next year, if you get cancer and there's a particular hospital that you want to go to, maybe it's MD Anderson, maybe it is Emory University in Atlanta, lots of different great hospitals that deal with particular types of cancer, and you can't go there to get coverage, you're not going to care that they cleaned your teeth last year. So that is why we say that you choose the health plan based on the health plan. Yeah, I like to tell this little silly story, and no making fun of me, but my favorite food on earth is scrambled eggs. I love scrambled eggs. I eat them almost every single day. However, if I married somebody based on the fact that they made really good scrambled eggs, that'd be great and everything, but it would not sustain the relationship when trouble comes. I like to think of these extra benefits as really good scrambled eggs. They're great. However, when trouble comes and you really need to use your health plan, they will not sustain the relationship with your health plan. So you don't make choices on what plan to get based on these extra things. You make the choice based on the health plan itself, the network, the copays, all those types of things, and then they normally will always come with something of these extra benefits, and you take full advantage of whatever that they come with. So now that we've talked about a few things about how Medicare Advantage works, let's talk about our next subject. So now that we've talked about a few of the experiences on an Advantage plan, and we'll cover some other stuff in just a minute, let's talk about the different types of Advantage plans. We'll start with HMO, or Health Maintenance Organizations. HMO was a bad word 20 or 30 years ago. However, it's not quite as big a deal as it used to be, especially in the Medicare world. And HMO, how it works is you have a set network of providers, whether that be doctors or hospitals, or places you can go for testing, things of that nature. And if you go outside of that network, you do not have coverage unless it's an emergency situation. But the reason I say that it is not quite as big a deal as it used to be is that there are some companies, in some markets especially, that have nationwide, very large, ubiquitous networks that include most major hospitals, most doctor systems, things of that nature. That's why it's vitally important to make sure that you get on the right plan. The second type of plan is a PPO, or a preferred provider organization. When we talk about a PPO, you still have a network, but it is a preferred network. So you can go outside of that network if you want to, but if you do, you're normally going to pay more out of your pocket than you will when you're inside that preferred network. Private fee-for-service plans. We won't belabor PFFS plans very much. The reason is you don't really see these very often. They are original Medicare as far as coverage. However, they have a maximum out of pocket, and they are provided by a private insurance company. Health Maintenance Organization POS, or HMO POSs. These are actually really good plans. These plans, you still have a set network, but you can go see anyone that takes Medicare as long as you have a referral from your primary care doctor, and that particular doctor that you want to see is okay billing the plan. okay? So in a lot of situations, you can live in one place and maybe see a specialist in another place. I have a lot of physicians here locally in Tennessee that go see a particular gastroenterologist in South Carolina. They're able to do that because they have an HMO, POS, and they have a referral from their primary care physician. And then special needs plans. Special needs plans are exactly what it sounds like. It's going to be folks that have special needs. The most common special needs plan is going to be a dual eligible or a dual special needs plan. This is somebody who can get both Medicare and Medicaid, meaning they're dually eligible for both. So these are plans that are designed just for them. The second type of special needs plan is going to be a CSNP or a chronic condition special needs plan. These plans are for folks with certain diseases. You're most commonly going to see these for diabetes, or whether you call it diabetes, or how in the South we say the sugar diabetes, okay? But there are people that have particular diseases like diabetes. The second, you'll see them for like COPD, you'll see them for heart disease. You're starting to see quite a bit of them for ESRD or end-stage renal disease as well. And so these are folks that have certain diseases, and they're plans that are specifically designed to help them in the best way possible. And then lastly, we have ISNPs. These are institutionalized special needs plans. These are for folks who are in nursing homes. They're designed for folks in that particular situation that they're staying in a nursing home for long-term care, and so they are designed just for them. So now that we've talked about the types of plans, let's talk about a few more things we need to remember when we talk about Medicare Advantage or Medicare Part C. So what are some key things to remember when we talk about Medicare Advantage or Medicare Part C? The first thing is that you must have Medicare Part A and Part B. So you must have Medicare Part A and Part B. The second thing to remember is that you must live in the plan's service area. When we talk about service area, most commonly we're going to be talking about a collection of counties, okay, maybe 5, 6 counties, maybe a few more, a few less, depending on the state and the region. Some states have different service areas for every single county, but for the most part, it is going to be a selection of counties, okay? I like to say, I would say that if you wanted a plan from Kalamazoo, Michigan, you had to move to Kalamazoo, Michigan, because that was my favorite name of a city that I'd ever been to. However, since then, I've been to a little place in Arkansas called Toad Suck, Arkansas, and so now I say if you want to plan from Toad Suck, you're going to have to move to Toad Suck. A great example of this is I had some folks that moved from Southern California here to East Tennessee, and they had a plan that was designed for Southern California. So when they moved, they had to get a plan that was designed for here in Northeast Tennessee. They had to get a plan for their new service area. Some other things to remember, you must use the card from your Advantage plan in order to get services, okay? So if you go to the doctor, you go to the hospital, you go to the pharmacy, you're going to use your Advantage plan card in order to get services. So you have one card that you'll use at all 3 places. However, you're going to want to keep your regular red, white, and blue card somewhere safe. The reason is that today you may get put on the best Advantage plan for you, if an Advantage plan is for you. However, things change. In 5 years from now, maybe you yourself move to a different region, or there's a new plan in the market, there's a better plan in the market. Maybe you need to be put on a new medicine that's covered on better by one plan than it is by another. And so you're going to need that original card in order to make a change in the future. So these are some key things to remember. You know, we started out talking about Advantage plans, and one of the things I said was that people seem to have very strong opinions about Advantage plans. They're either strongly for them or strongly against them. So I thought about what would be the best way for us to talk about why that is. And so I think what we should talk about maybe is some of the strengths and the weaknesses, kind of the good, the bad, the ugly of Advantage plans. So let's start off talking about the weaknesses in a lot of cases. And this isn't always the case, but when we look at Advantage plans, these are some things to make sure that you're looking at. First off is the network. You know, oftentimes these plans will have lots of those extra benefits that we talked about. They'll have the great dental and vision and hearing and things of that nature. However, their network isn't fantastic. So you may want to go to a doctor or a hospital that you can't go to. Maybe you have something arise in the future, like a very complicated detached retina or something like that, and you want to go to Duke University in North Carolina. Or there's a particular back or knee surgery that you want to have, and you want to go to the Cleveland Clinic in Ohio in order to get it fixed. And maybe you're not able to do that depending on the Advantage plan that you have. They're not all like that, but some of them do have very constrictive networks. The second thing is prior authorizations. This is something that has been in the news, especially in the last 6 months, is how many prior authorizations that you see on Advantage plans. Some of companies are really easy to deal with, and prior authorizations is very quick. Some of them make you jump through some hoops sometimes, depending on what's going on, the type of procedure that needs to be done, things of that nature. And a lot of times that gives Advantage plans a bad name. Not all companies are like that, and that's another great reason to talk to somebody that knows what they're doing, because they can help you and understand which companies are easy to deal with and which aren't. The next thing is hospitalizations. Nobody likes to think about getting sick and needing to be in the hospital, but depending on the market and the plan and the region, things of that nature, there are some plans that it can be very expensive to go in the hospital. Most commonly, they're going to be somewhere around $300 to $500 a day for the first 4, 5, 6 days, even up to 10 days that you're in the hospital. So it's going to depend on the plan, and it's going to depend on the market. And so again, this is something that you want to make sure that you're looking at when you choose your Advantage plan. Next is cancer. You know, when we talk about cancer, cancer is a bad word. People hate that C word. When they see that C word, it gives them anxiety, it gives them angst, and one reason is cost. And so when we talked about Medicare Part B and how that chemotherapy was a Part B drug, that's something to definitely keep in mind when you're going on an Advantage plan, is maybe having something in place to help your Advantage plan in case you were to get cancer. And then lastly, it's Part B drugs. If you've seen our Part B video, you know that any drug that goes into your body through a machine is a Part B drug. So when we talk about that, most commonly today, you're going to see these for like autoimmune diseases. You'll see them for folks that maybe their body doesn't absorb certain vitamins or iron as well. And so they have to get infusions of those drugs or those vitamins and metals into the body in order for their body to absorb it. If you're somebody in that situation, it's very possible that an Advantage plan is not for you. So now that we've talked about some of the weaknesses or some of the ugly parts of an Advantage plan, let's talk about some of the strengths, because there's obviously some strengths, because for the first time, more than half of Americans that are on Medicare are now on Advantage plans. This is the fastest growing type of plan in the Medicare market. So there's really got to be some good things about them, no matter what you've heard. And so let's talk about some of those really strong things. First off is cost. Okay, like we said earlier, a lot of these plans either are free or have a very low premium, and in general the premiums on these don't tend to change very much year to year. And so folks really like that the premium is very low, so there's a very low cost to the insurance itself. The second thing, again, we don't choose a plan for these, but in a lot of cases, the extra benefits are very beneficial for folks, especially in situations where they can get really good dental and they need dental coverage, right? Or you need vision coverage or those over-the-counter drugs. You want to go to the gym for free. Some markets even have things like food cards for folks, especially in low-income situations, okay? And so some of these extra benefits can be, again, we'll say it one more time because it makes sense, very beneficial to those folks in those situations. Flexibility. A lot of people like the flexibility of an Advantage plan because you're able to change them on a year-to-year basis. You can go on a plan this year, and if there's a new plan that comes out that's better, or your situation changes and you're on a new drug, or you want to see a new doctor, you're able to be flexible year to year on these plans and make changes to make sure you're always in the plan that best fits your health situation. That's a big thing that we do here at SureSource. If you were to ever ask for our help, is we sit down and we talk with our clients on a year-to-year basis during the annual enrollment period in the fall, and we make sure that everyone is still on the right plan. And then lastly, drug formularies. We mentioned this just in passing earlier, but in general, the drug formulary is going to be stronger on an Advantage plan than it is on a standalone Part D plan that you would put with a supplement. For folks who are on certain drugs, that's a good thing to know that it may be more beneficial for them to be on an Advantage plan just because of how much money they can save on their medicine. So what does all of this mean to you? We say this on every particular video, but this one in particular, it makes a big difference. What does this mean to you? Everyone's situation is different. You have a different health situation than anyone else. You see different doctors. You're on different medicines. You have different financial situations, right? And so that's why it's important for you to know that there are a lot of different types of Advantage plans out there. There are a lot of different companies that do Advantage plans. Some of them are really good. Some of them aren't quite as good as some of the others, is how we'll put it. And so that's why it's important to talk to somebody that knows your market, that is local to your area, that knows which doctors take which plans, which plan is easy to deal with in your market, things of that nature. So that is really what it means to you, is that there are lots of choices out there, and it's important to make sure you're on the right plan. So what if you need more help? Again, this is something that we also say every week, is if you need more help, we're here for you in any way that we can be. If you have questions, you can reach out to us. There's about 3 different ways for you to do so in the description of this video. If you reach out, those all come to me personally, and then I'll get you to the closest agent in your local market that is best equipped to deal with your particular situation. And so if you reach out to us, we never charge for anything that we do, but we'll help you in any way that we can. Well, again, we hope you learned something today. We want to thank you for stopping by. If you don't mind, like this video, subscribe to this channel. That helps us out quite a bit. And we hope you have a blessed rest of your day. Thank you. Bye-bye.